What's up, future respiratory therapist? Big question here. What are you going to school for? I hope this video brings you some clarity. Let's dive in. What's up, future respiratory therapist? I have a question for you today, and it's very simply this. Why? Why are you doing what you're doing? Why are you going through this insanely exhaustive school process to become a respiratory therapist? Why? Now, I don't know the answer to that question. Only you know the answer to that question. What is your why? That is an important question that you need to ask yourself right now, today. And if you'll answer that question, and if you'll be honest, you will find that your level of engagement from a student's perspective will probably increase if your why is valid and a good reason for doing it. Now, the reason I'm doing this video, and it's not really, well, I mean, let's just be honest. Is it an educational video or is it not? I don't know. I think it's 100% motivational, because some of you out there right now are probably thinking I should just quit now. Like, you're probably in your second semester and maybe your grades have struggled and you're asking yourself, why am I putting myself through this? Do I want to go through this? Do I even enjoy what I'm doing? Well, I'll tell you right now, if you don't enjoy what you're doing, stop right now and get out. Because what our field needs right now more than ever before is a bunch of individuals that want to learn and be experts in the field of cardiopulmonary. That's it. You want to be experts on the heart and the lungs. And a lot of times it's just respiratory therapists and people just say, oh, that's just the lungs. Well, no. We learn everything about the heart and the lungs and the kidneys. And I can give you a story from yesterday about the abdominal cavity. We had a patient with a distended abdominal cavity. You could tell the pressure was very high. Well, what this does is it pushes up on the diaphragm. It reduced our lung compliance, which raised our peak inspiratory airway pressures. It also raised our plateau pressures. It also raised our mean airway pressure. Now, what this was doing was causing a negative effect on the cardiac system. So this patient was also maxed out on pressors, blood pressure medication. Well, what ended up happening from that? The kidneys stopped producing urine because the blood pressure was down. So you see how you're going to school to be experts in the respiratory system, and you learn aspects of the cardiac system, but the abdominal system, the intestinal system also plays a role and affects the respiratory system, which affects the cardiac system, which affects the renal system, and all of these things play together in one big ball. And it becomes one big circle. It's a circle. The lungs, the heart, the abdomen, the kidneys, the liver, neuro. You cannot separate them. They are all interconnected. And if you don't recognize that right now as students, and you don't want to be a part of this big process, you don't want to be a part of this, then you need to figure out a way to exit stage right. Just find a way to separate yourself. It's okay. Respiratory therapy is not for everybody. 100% not for everybody. So as soon as you figure that out, you can get out kindly and go find something that is for you. And I would love if you would do that. Now, for those of you that want to stick around, I'm going to ask you to dedicate yourself to learning every single aspect on how all of this plays together, because it all comes together. You are going out there to be a respiratory therapist, but that does not mean all you're going to do is aerosolize albuterol. You're not just going to write down numbers from a ventilator. You're not just going to do CPT. You are doing something for your patients that is going to benefit the pulmonary system, the cardiac system, the renal system, and every other system in the body. You have to understand this. We are respiratory therapists. We are lung experts. But we also understand how that impacts everything else. And that's where I want you to go with this today. Is that if you're in respiratory school right now and you are studying these things, I'm going to challenge you to think about how everything you are learning also affects something else. Albuterol, you aerosolize it. It's meant to cause bronchodilation within the lungs. But what effect does that have on the cardiac system? CPT, we learn it. You put your patients in Trendelenburg, depending on where the consolidation is. And you perform this, and that's great. What effect does that have on the neurosystem? What effect does that have on ICP? Can you put a patient, a neuro patient, into Trendelenburg? Should you put a patient that's a neuro patient into Trendelenburg? Perhaps, probably not. So being able to think about these things is what's going to make you a respiratory therapist. You can increase PEEP all day long, but if increasing PEEP reduces venous return, then what does that do on blood pressure? And what does blood pressure have to do with kidney production and renal output? You see, everything is related. And that's all I want to say in this video is understand that what you're getting into is something bigger than what you think it is. You think it's lungs, but it's much larger than that. So I just want to encourage you today. I want to encourage you to dive so deep into your studies and figure out the things you don't know so you can ask the questions to learn about those things. Because while you may not ask questions yesterday because you didn't know what you didn't know, that's even more fuel and more motivation for you to go figure out what you don't know. Because we need you. The educators need you asking these questions so that we know what you know and what you don't know. And once we can identify what you don't know, then now you can be better educated and we can help you more. What I'm really trying to say at the end of the day is to send a message that all comes down to this. Humanity. This is why you're going to be a respiratory therapist. You are seeking a degree so you can pass an exam, so you can get a license, so you can go out and take care of other sick humans. This field is a privilege to be a part of. And until we start operating at that level to where it is a privilege and we are operating at the very highest level of our scope of practice to impact humanity, to impact for the betterment of our patients, then we're just collecting a check. You're just getting paid. And for the deposit that you put in for this education, the rewards are pretty damn good. The ROI on a respiratory therapy degree is pretty damn good. But it's not about the ROI, the return on investment. It doesn't matter. The paycheck doesn't matter. And I'm probably pissing off some people right now, and that's exactly the purpose of this video, is to identify who hates me saying that your job is to take care of sick humans at the very, very highest level, at the most high level of quality care. It's not about how many treatments you can do. It's not about how many vent checks you can get done. It's about how much you can impact another human's life. And that's the truth. And if you don't like hearing that, then maybe it's time for you to go find a new profession. Because this profession is an honor and a privilege to be a part of. And if you're in school right now and you're learning all this stuff, and you're going to go out there and you're going to work to be a phenomenal respiratory therapist, then good for you. But if you're just looking for that check on the backside of things, we don't have a place for you. And I hope y'all tear me up in the comments. I hope the comments below are so hateful, saying, oh, we're not superheroes. Of course we're not superheroes. Nobody said it. I never said anything about superheroes. I said humanity. There's no part of superheroes that has to do with humanity. We're people taking care of people. That's what we are. That's what you're learning to be. Own that honor and own that privilege. And go out and be a respiratory therapist that impacts people's lives. Whether they're sick and trying to die, or they tried to die and they're getting better, or maybe neither of those. Maybe they're just injured or sick for the short term. Understand that you have a role to play in that person's recovery. And I expect big things from you. Remember, average is easy. Don't be it.